Thank you guys for logging on. I'm your host, Michael Bailey of the Minority Marketplace, and my guest today is Miss Carolyn Pearsall of Primary Health Source. Carolyn, how are you doing today?
I'm great, thank you.
Before we get started, won't you tell us a little bit about Primary Health Source?
Primary Health Source actually is a education-based opportunity for people to come onto the site and learn about what it takes to actually get into the right product, health insurance product in the marketplace, and then also learn a little bit more about proactive things they can do with their health to take advantage of their of what they are purchasing through the health marketplace.
Okay. Now, you guys are getting ready to start helping people sign up for the Affordable Care Act.
Yes.
What are some of the primary points that we need to know when picking one of these health plans?
Well, I think there's a couple of different things. And first of all, you need to pick a plan that feels good to you. And when I say that, I mean it needs to be something where it's, first of all, you are taking on a risk.
Right.
When you that's what insurance does. It takes the risk away from you and puts it on, gives it to the insurance company. So the first thing is you need to look at how much risk you can afford to take yourself and how much you need to transfer to the insurance company. The second thing that you need to do is you need to make sure you're picking a plan that is absolutely usable for you. And what I mean by that is it's not enough just to pick a plan that's inexpensive and with a monthly payment that is low, but you need to pick a plan that will have a copay. Let's say if you have children, and you don't want to have to take on the full part of the payment, but that goes against the deductible. You want to have a copay. You want to have a plan that actually makes sure that your drugs are covered, because not every plan covers the same drugs in their formularies, and also your networks. You want to make sure that the doctors that you need are in the network that you have, and some doctors are not in, maybe the networks down at the coast are not the same as the networks here in the Midlands or the upstate. So, and that's true in other states as well. And then lastly, you need to make sure your benefits are there that you need. And it's not only the drug benefits and the hospital benefits, but it's actually the benefits as far as what they will pay out for those drugs and whatnot. Is it a tier 1 drug? Is it a tier 0 drug? Also, if you're getting cost sharing, will that take those drugs down to possibly where you pay nothing for them? And then there's all kinds of added benefits people don't take advantage of. Some products now even have dental and vision built into the plans. So there's a lot of benefits that need to come about.
All right. Now, insurance is always a complicated process, and I remember there was a lot of confusion with the rollout. So now, is your company acting as navigators, or you guys acting as agents, and what's the difference?
Agents, we are agents. Everyone who works with Primary Health Source is an agent. The biggest thing is when people go to healthcare.gov, or maybe they go to a local organization that's helping people sign up. Most of the time those people are sponsored through a grant type program, and they are actually help people enroll. They help people in the enrollment process. Now what that means is the person can have a situation where money-wise, they can help them fill out the things, fill out the data, fill out the data, get the subsidy that they need, but they cannot, a navigator cannot help them pick the plan that is best for them.
Right.
Now, as far as with agents have to go to school, they have to continue with their continuing education. They can actually advise you on the best plan based on your particular circumstances. Navigators have their role, don't get me wrong, but when it comes down to the finished product and making sure that you have a usable plan with the benefits you need, it's really better to talk with an agent.
Okay, okay. Well, that's good to know. All right. I wanted to ask you a question. What can people do, or what is the process of? I remember last year when they did the rollout that a lot of people got discouraged because they did not qualify. So what what are some of the things that someone can do if they find out that they don't qualify for any of the plans?
Basically, in 2014, that did happen a great bit, and that was before they implemented a ruling for hardship cases, which basically in South Carolina, North Carolina, and Georgia, we did not take the expanded Medicaid benefit. So what happened was people who normally would have been covered with that expanded Medicaid benefit could not qualify. They fell into a hole. And what I mean is you have to make a certain amount of money each year in your gross income in order to get to be eligible for marketplace insurance. Now, if somebody does not quite meet that, but yet they make too much for the Medicaid program, because the expanded Medicaid program was to fill in that gap. Since we did not take that, there was no gap to fill in. So what the government did is they came back and they said, okay, we see that this has happened in a lot of states. We will allow these people to file a hardship exemption, and they can go online. They can go on and at phsworks.com and download a book that will tell them about that. And there's a link in there. What you do is you apply through healthcare.gov for a hardship exemption. And once you get that hardship exemption, then you can possibly qualify for a special enrollment period. And that allows you to get a catastrophic plan, which is a very low cost plan. It won't have all the bells and whistles that you could have with a cost, if you receive cost sharing, but it will give you something that will help in the event of a major crisis in your life. And those are the kinds of things that can cause people to, really hard time, if not bankruptcy. So that would be our best advice to them, is to file for that.
Okay. What are the dates? What are we looking at as far as enrollment start date and end date?
Enrollment started November 1st, and it will run through January 31st. I guess people would like for it to run through July. January 31st. In the past, we've had some extensions to that. I don't know this year if we will or not, but that's what we're looking for. Okay.
Or are they looking at doing a penalty this year? I know that was a talk if you don't enroll.
Every year there is a penalty, and unfortunately it is going up. When it started out, basically your penalty was about $90 a month. A year. This year, the penalty, if you do not get insurance, for an adult is $695. For a child, it's $347.50, and for a family, it cannot go over $2,085. That's a lot of money to pay to the government for the penalty if you don't get insurance. Most people can get insurance for what they would pay in the penalty.
Okay. Now, if I needed some help enrolling, walk me through that process.
You could do a couple of different things. You can go on the website, the PHS Works website, and you can log in. There's a link there. It will let you basically put in your income, your household members or whatnot, and then it will give you an idea of the plans that you would qualify, what your subsidy would be. That's kind of an estimation. And then there's a link on there that says you want to talk with somebody. Or at that point you can pick up the phone and call the number, and you will be taught with an agent who can walk you through the enrollment right there.
Okay. Ms. Carolyn, before I let you go, could you give us some contact information in case somebody had some more questions that they would like to ask?
Yes. They can go online to phsworks.com and they can walk through the process there. They can actually enter their information and see what their subsidy would be and the cost of different plans. They can also call 844-540-8627.
That's right. All right, Ms. Carolyn, thank you for taking the time to talk with us.
All right, thank you.
And like always, if you have a product or just published a new book that you would like to have featured on the Minority Marketplace, you can always give us a call at 803-619-3752 or email us at info@theminorityi.com.